Hi everyone, I'm Christopher Voscopoulos and we're going to start. Thank you for joining me. The topic for today is going to be my personal journey through the COVID-19 pandemic and what it's taught me about health and well-being. So I want this to be interactive, so please ask questions. And you can interrupt as I'm chatting and ask questions, and I'm happy to answer them then. And also, for full disclaimer, I live and breathe medicine. And I want this to be about you and giving information to you. So if I happen to mention things like acute respiratory distress syndrome and cytokine storm, just ask for a timeout and ask for me to re-explain things so that I engage you as much as possible and I can give you as much information as I can. And so let me talk now a little bit about the COVID-19 pandemic and what our experience has been here at Southern Hills Hospital. So like all of the hospitals in the area, we've had a lot of experience with this new entity. But as a critical care doctor, the thing that I was seeing the most was something perhaps that you might have heard about on the news, which is that really the great number of patients that ended up in our ICU had what we call comorbidities, you might heard used saying in the news, or what we say underlying health conditions. Basically, individuals who have underlying illnesses appear to be the most susceptible to this entity. And that's a very important thing for us to discuss because there are many things that we can do about that if we're empowered. And that's what I want to do as part of this presentation. I want the opportunity to be able to empower you about things that what you can do right now. And not only will they have the benefit of helping to protect you against COVID, but the other, what we would call side effects of doing the things that we're going to talk about will just greatly improve the quality of your life. And so when we talk about comorbidities, what we're talking about is certain entities that affect mostly a certain part of the body, and it's really the blood vessels. So let me take a step back and tell you what I mean by that. As time has now gone on with COVID-19, we're starting to understand that this appears to be what we call a vasculitis. So what a vasculitis is it is an inflammation in our blood vessels. And this is very much so novel to us in many regards. When this first hit, we were all thinking that this was a respiratory illness, and for good reasons, because people presented with respiratory complaints. A little while later, what happened is we noticed that individuals had other difficulties. They were maybe clotting their blood. They were maybe having renal failure. Their kidneys were being affected, and other manifestations. And as we were seeing all these different body systems being affected, well, we started thinking that there has to be something that's a little more underlying that is part of the problem here, something that is central to all of those different body systems that could affect all those different body systems. And again, it appears as if those are the blood vessels. And so what diseases do we know affect the blood vessels? Well, what we know affects the blood vessels is diabetes. And unfortunately, this is very prominent at the current moment from a public health standpoint, not just here in America, but in the entire world. What happens with individuals with diabetes is the high levels of glucose in the blood system can act as a type of what we call inflammatory marker. Inflammatory means that it's going to create some type of inflammation within the blood vessels. Individuals could have high blood pressure, what we call hypertension. So here again, we have our blood vessels, and what basically happens is that with higher pressure within them, it puts more stress, and those blood vessels could also be affected. So I'm going to actually skip sleep and mental health just for a second and come back to it. Smoking is a little easier to mention. Smoking directly affects the blood vessels. So not just the lungs when you smoke, but it is what we call a pro-inflammatory type of habit, to where it creates inflammation. Again, that swelling within blood vessels. But now also things like sleep. And that might be really kind of surprising to some individuals. Why I'm mentioning things like maybe sleep and blood vessels? Well, because what happens is that if you have poor sleep, your body is stressed out. And what happens physiologically when you have poor sleep is you elevate something called cortisol, which is one of your stress hormones. And then when that cortisol is elevated, it could elevate blood sugar, it elevates blood pressure, it will likely lead you to want to eat more during the day, and that could lead to things such as obesity, which we will talk about. So sleep, so essential. And when you look at sleep habits for Americans, they're pretty bad. The average that we recommend for individuals to sleep is somewhere between 7 and 9 hours, and not many of us are getting that. So we have a first question here.
Yes. Stephanie would like to know, how do I protect myself when I go back to work? She is a bartender. And repeat the question.
Excellent. So we had a question from an individual who is a bartender, who asked how can they protect themselves when they go back to work. I am going to answer that in just 1 second. I'm going to finish with this slide and just talk about mental health, and then I'll divert, and then I'm happy to answer that. So in terms of mental health, it's very much so like sleeping, and that's why I wanted to talk about them together. Mental health, if you have a lot of stressors in your life, you're increasing those levels of cortisol, and you're predisposing yourself to things like high blood pressure, again, diabetes, the impulse to want to eat more when the cortisol is high, and to gain weight. And so the pause here before going to the next slide. COVID-19 is a impressively transmissible disease. It's amazing how easy it is spread. And one of the most important things that the CDC is trying to help us with is what we call slowing the spread of the disease. The concept there is that to a certain degree, it appears that it can be inevitable for the virus to spread. But what we want to do is we want to handle that spread in the most responsible fashion by being able to provide the best health care for individuals if they happen to be one of those individuals who gets COVID and gets sick from it. Recall that right now, our current understanding is that up to 50% of people could get infected with the COVID-19 virus and have absolutely no idea that they were infected and that they had it. We call these asymptomatic individuals. Actually, this talk is really about the other, portion of those individuals who might possibly get ill, from COVID, and what we can do about it. And I'll come back to that in a second. So with that knowledge about the spread, what we're doing is we're asking individuals to do a few things, and I'll touch on some of the highlights, and that is to wear a mask. And the reason why we're recommending for people to wear the mask is because when the virus is transmitted largely through the air. So an individual has it, say, in their lungs, they breathe it out, it becomes aerosolized in the air, and then an individual could breathe that in. It's just not as simple as someone has one cough and someone breathes it in and you have it. It's actually more complicated than that. There's certain things that you would have to actually breathe in a certain amount of the virus possibly to get ill. So I don't want you to think that you just go past one individual and that's it. So to those lines, what you could do on the other end is you wear a mask yourself. So with both people wearing masks, then one person has less of a chance of aerosolizing it, and the other individual has less of a chance of breathing it, and that helps. The other thing that helps in this is what we call the social distancing. That's where that 6 feet come in. Because what you're trying to do is you're trying to minimize that area to where the virus could be in the air, and by being away from individuals in the 6 feet fashion, you reduce your exposure. The last thing that I'll mention is just washing your hands and not touching your face. Why is that? Well, that is because the virus is again transmitted and has to get into your body through your lungs. And it's amazing that if you had never thought about it before, how much time we spend touching our face, our eyes, our lips, it's a habit and it's difficult. And so you can consciously try not to do that, but then also to wash your hands and use sanitizers. And that would be the best thing that you can do for yourself.
We have a question about masks.
And I have another question here about masks.
Do masks really work? You kind of touched on that. Do they harm people with breathing problems?
So masks do work.
Repeat the question.
I'm sorry. I got a question about do masks work, and can they possibly harm individuals with breathing problems? So yes, masks do work really almost regardless of the type of mask you use. So let me just review one more time the basics, in that an individual who's positive with COVID would breathe, and then particles can come in the air, and then you would possibly breathe those in. So you really have a whole variety of masks. You have just cloth, non-medical grade, maybe just something out of cotton. And then on the other side of the spectrum, maybe you would have something like what we use commonly in the hospital in the operating rooms, maybe what's called an N95 mask, so something that is a little more medical grade. So is the medical grade mask able to both reduce exposure from someone who has COVID from getting in the air, as well as reduce someone breathing it in better than a cloth mask? Yes, it's medical grade. But that doesn't mean that the cloth mask doesn't have any benefit at all. It has great benefit. It will reduce to a certain degree both exposure and breathing it in. So whatever you could use and you're available to yourself, there is a value. It is also true that certain individuals could have a difficulty with the mask. So let me take a perhaps maybe more popular disease state that maybe individuals might have a little more familiarity with, something that we call COPD disease, chronic obstructive pulmonary disease, something that commonly individuals who have smoked in life get. Very often those individuals have to use supplemental oxygen, so additional oxygen to breathe. And so that could be a situation to where that individual putting something on their face really could be very, very, very difficult for them, because under normal circumstances, they have to use supplemental oxygen to get by. And so yes, it could be difficult for certain individuals. And it's also maybe not just anatomic or physiologic problems that we think of. It could also be some psychological type of entities as well. Individuals with claustrophobia or otherwise, this could be very hard for them psychologically. So there are cases, and yes, that is possible. If there are no other questions, I was going to... Okay.
We didn't answer the first one about I'm returning to work as a bartender. How do I protect myself when I go to work?
So I'm going to come back to the question that I'm a bartender, I'm returning to work as a bartender. And my purpose in answering that question for how do you protect yourself is with the mask, with washing your hands when possible, more frequently, with not touching your face, and as much as possible being socially distant. You could also do additional maneuvers, such as if your place of work could have maybe things like a clear plastic barrier or otherwise to, again, also prevent some of the transmission in front. Those would also be reasonable. I'm a little more where I don't really concentrate more on the specifics, because you could be creative and there are a lot of ways that you can protect yourself. I think if you just understood the underlying principle here, that this is predominantly a respiratory and airborne entity, With that in mind, you could take other steps that you could possibly think of to further help protect yourself.
This is a special one. Hi, I'm Alfred. I'm a COVID survivor that you treated. I would like to know if I can be infected again. Thank you so much to you and Southern Hills Hospital for giving me another chance at life.
I happened to get a question, and this individual has been on the news, so I feel comfortable mentioning the name because they've been disclosed before. And this was from Alfred, which was an individual that we had the honor really of treating here at Southern Hills in our ICU and was sent home. He had an important question about whether or not he could be reinfected. This is a very rapidly evolving area right now for our understanding. And the simple answer to that is we do not know. Now, of course, there are more elaborate answers to that. So right now, what we understand is that individuals can create an immune response to this, meaning that they can create what's called antibodies in their body against the COVID-19 virus. So this happens, maybe it's a little more familiar to you, to where every year many individuals get the influenza vaccine. And the purpose of that is that by getting the vaccine, then their body creates these proteins, again called antibodies, and it provides a certain degree of protection. So we do know that this is happening in COVID-19, but we're trying to fully understand exactly what happens. And so right now, some of the literature that is out there from what we know is that when people have antibodies, we perhaps maybe are seeing that these antibodies aren't lasting that long. Now, that shouldn't be like immediate of concern. When I say not lasting that long, maybe they go away in 3 or 4 months. But medicine is a very complicated field, and we have to define what do we mean by going away. Possibly what means by going away is we're just simply not detecting them. It doesn't mean that they're not there, but maybe we don't have the proper technology to detect them. Or it could be even more complicated to where the cells that make the antibodies, those are called plasma cells and B cells, maybe those are still functional. If you were re-exposed, you would just make the antibodies again. We simply don't know. We're also not sure if everyone will develop an immune response. And so there's been information out of the Navy for when certain Navy ships got infected and young individuals were exposed. Antibodies maybe were only detected in up to 60% of those individuals. And so again, we're not sure if maybe only 60% developed antibodies or maybe everybody did, but again, we're just not using the right technology to find out. And so at the current moment, I would say that it's reasonable to assume that individuals will develop some type of immunity. We don't know how long that immunity will last for, and we don't know how robust that immunity will be. So yes, at the immediate moment, it is a possibility that someone could get reinfected.
Alfred says thank you for caring for him. And then another question we have is, I am returning to work. Should I get an antibody test?
So I got a question, and the question was, I am returning to work, and should I get an antibody test? I think that was good timing for this question because I just talked about antibodies, that is difficult because from what I just talked about with the antibodies, we're not really quite sure what if you were positive or negative, what a positive or negative test would mean based on what I just explained. There are also some wide variations right now in antibody testing, meaning that someone just doesn't create one antibody to the COVID-19, and we just detect that one. Individuals can create many different types of antibodies. So the question is based on the test that you're getting, what antibody is being tested for? And so at the current moment, we are not really quite sure what the utility of the current antibody test would be for you. We are quickly standardizing this and having a better understanding, and I think that this will be clearer in the future. So I'm not discouraging you from getting the antibody test. You just have to be very cautious in interpreting what it means. Okay, if there are no more questions, I'm going to go to I'm going to go to a next slide here. And so I talked about these 5 particular areas, and I'm just going to briefly talk about these things a little more and introduce things of what we can do right now and to help ourselves. And this is really important because for some of the information that I just presented to you, in terms of we're trying our best as a medical profession to understand what, say, an antibody test means and what the best antibody tests are. And we're trying our best to come up with treatments. And we're doing research at lightning speed to figure out what some of the best treatments are. But these things take time, and we're trying our hardest to possibly come out with a vaccine. But the amazing thing is that since we know that the individuals who are most susceptible to COVID-19, generally speaking, have underlying health conditions, what if we address those underlying health conditions right now to the best of our ability? That could possibly make it to where you're exposed, and instead of having a mild illness, you're completely asymptomatic. Or it could make you right now where if you're exposed, instead of having to go to the hospital and spending a few days in the hospital, you just have a runny nose and a few minor symptoms and you get over it. Or it could go from you get really ill and you present, normally you would have presented to the ICU under my care, but now you have to go to the hospital and be on the floor, and you eventually recover and you go home. Or in the most extreme case, you get ill and you're in the ICU, and it's not really my efforts that helped protect your life or my team's effort that helped it. It was really what you did before you got to the hospital that further decreased your risk so that you could survive. So these are important things. So we'll briefly talk about them now. And then at the end here, I want to offer that if there's interest here, we can come back and we can do this again, and we can talk really in great detail about each of these and what you can do to further take steps. So the first two that I really want to talk about together are diabetes and high blood pressure. And the reason why I want to talk about them together is that perhaps maybe you might not be aware of this, but not everyone who has diabetes and not everyone who has high blood pressure possibly might have excess weight, but a great number do. And one of the amazing things that we know in medicine is that if an individual is able to lose weight, that up to 2/3 of those individuals, or some number thereabout, could possibly cure. That is an amazing statement to say right there. Possibly cure their diabetes and or their high blood pressure. No longer requiring medication, they're fine. This is amazing. I do understand that it is difficult, and we have a weight problem in America and in the rest of the modern developed world. This is difficult, and we just see it with the numbers. But perhaps maybe during a future session we can talk about some of the details and techniques that you can use and what strategies you can to accomplish that. But if that was possible, these are 2 big things that are affecting the blood vessels. And say if you were able to lose 20 or 30 pounds, not only would the rest of your life be better and you would increase your lifespan and your exercise tolerance and so many other wonderful things, but you also would dramatically reduce your risk of COVID-19. And again, that's something that we can do right now. So the next item that I'll talk about is sleep. Sleep and mental health are a little bit together as well. But again, I want to emphasize what you can do in terms of sleep is not only to get the recommended 7 to 9 hours as well, but there are so many individuals right now, perhaps maybe with excess weight issues, and perhaps they might have what's called obstructive sleep apnea. So it's difficulty breathing at night. And those individuals would really need a machine, what's called a CPAP or BiPAP machine to help them breathe at night. And perhaps they don't have that. And if they got something like that, then they can not just get the required number of hours in their sleep, but they would get the higher quality of sleep, which is so important. But it's not just individuals, perhaps, when you talk about sleep hygiene with perhaps obstructive sleep apnea. It could be pain issues for individuals where they have a hard time getting a position that's comfortable for them. And there they can explore with things like different densities of memory foams or other mattresses, and that's important. But the concept here is really to overwhelmingly emphasize that sleep is so important if you are going to try to lose weight and to handle the next topic of mental health, that is really a topic all in of itself, and perhaps we'll come back and talk about that in greater detail. So in terms of mental health, mental health is something that is still underappreciated and under-talked about in America. And it is not just mental health in terms of things that are more severe in terms of the spectrum, but it's just things like our daily stress levels. And so, for example, for myself, I take great care in trying to eat appropriate and eat a certain amount. And I've noticed that during the day, if I have an extremely stressful day, it's hard for me to maintain that. I have more of the impulses and urges and otherwise. So that's more on the subtle end. But for individuals maybe that have other, much greater stressors in their life, that's just even more profound. But there are so many things that we can do in reference to our mental health in terms of meditation, guided imagery, counseling and coaching, support groups for individuals, prayer. And so perhaps maybe we can come back and we can talk about what we know about in the medical profession with using things like meditation and otherwise. And I can present some research and education in that area. But it's really an amazing area, and I think it's underappreciated. And the last one is smoking. So I happen to be, in addition to critical care doctor, a board-certified addiction specialist. And there is still so much more that we can do for individuals in reference to smoking. And these days we have so many approaches that are available to individuals. So replacement therapies, medications, maybe even things like acupuncture and otherwise. And so with so many things that we have available to individuals, and with all the information that we know about how detrimental smoking is to someone's health, I would really implore individuals to come and to discuss these issues with their primary health care physicians. And again, this would be a great topic to talk about really for an entire hour, for all the different treatments that are available to an individual that might be really struggling in this particular field. And here is really my last slide. And the last slide is really, for all you individuals that are attending, thank you so much. I welcome any questions that you have right now. But also what I'd like to know is that if there is interest, we would love to talk about these 5 areas in greater depth for an entire dedicated presentation for each one of them to really empower you about what you could do to get not just decreased risk of COVID-19, but really the best health of your life. And so I'll pause here and see if there are more questions.
And you can repeat this. Roger would like to thank all the nurses and doctors at Southern Hills Hospital for putting their lives on the line.
Roger mentioned that he would like to thank all the doctors and nurses at Southern Hills Hospital for putting our lives on the line, and thank you. We are all in this together, and we all have a role to play no matter what our profession is. And we might go first, trying to deal with the crisis on our end in terms of the health perspective, but eventually every single one of us will have our opportunity to contribute. So hopefully we can inspire you to give your all when you're up next.
There is so much misinformation out there. Where can I go to find out information that isn't political? The
question was, there is so much misinformation out there, and where can I go to get information that is non-political. A great place for one-on-one education would be your primary care physician. And so there you can ask maybe specific questions related to your particular health status, and I would encourage you to do that. The other sites would be the Centers for Disease and Control, so the CDC. So the governmental, published information, and those would really be some of the best areas.
We do have other questions. Melanie is watching. She wants to thank you for doing this. She's been following you since she learned about your proning method.
Thank you. We got just a question and statement from Melanie, who just said that thank you. She's been watching us here at Southern Hills Hospital in reference to our proning method, and we appreciate that. We are really doing all we can to really, try to be the best healthcare facility we can be in this Las Vegas area to give you the best, results possible. All of us here meet every day and review the current literature and brainstorm and discuss and really try to be as novel as we possibly can be in our treatments to save as many people and have the best, best results. So thank you. I appreciate the sentiment back.
Dawn says, I've heard vitamin D can help fight against COVID. Is this true?
Yes. Dawn had a question in reference that she asked, heard that vitamin D possibly could be effective to help possibly maybe prevent or possibly maybe treat vitamin D. One of the difficulties with medical literature and medical research is that we have to look at so many individuals. Ideally, we would look at hundreds and thousands. And sometimes what happens is we have some papers that come out that have a positive result and other papers that come out that have a negative result. And then some people get discouraged and they're like, well, I don't know. That's fine. What happens is that when multiple papers come out, then we take a look at all of them together. We call this a meta-analysis. And then by grouping them all together, we have more information. So we are just getting information in right now in reference to vitamin D. And some of the information could possibly be positive, and some of the information wasn't showing any benefit. So here now, I'm just taking just a subtle step outside of pure medical information and just giving you, my personal perspective on this, and I want to make sure that that's clear. When you look at vitamin D, a great number of the population in America is deficient in vitamin D. And we know that supplementation in vitamin D can help you in so many aspects of your life. And so at the current moment, it might be reasonable to say that I don't see the harm in supplementing with vitamin D for all of the known beneficial areas that you get. And perhaps maybe it could help with COVID. We're not sure at the moment.
Nelson is asking, if you might be asymptomatic, but you still have a sore throat, when should you get tested or should you get tested?
So I got a question from an individual that they possibly might have a sore throat, and they're concerned about when they should get tested or if they should get tested. And so right now, really what we're recommending for individuals is that if you are symptomatic, to present to the hospital for testing. And symptomatic largely means at the current moment, and we are evolving this as we understand more, fevers, shortness of breath, perhaps loss of smell, maybe diarrhea symptoms, GI symptoms, etc. And so if you're finding at the current moment that your health is a little bit more at a level that you're concerned and you're finding compromise and otherwise, it's reasonable. If you're finding that these are extremely minor and they're just an inconvenience and it's something like that, which when it's going away, it's just a little annoying, perhaps maybe not. So it's a little more of a judgment call at the moment. Depending on the severity of symptoms, I can't give medical advice in this particular form, and I'm not. This is just really for educational purposes. You would need to really see your primary healthcare physician for a definitive answer of that.
Sarah would like to know if the heat is going to help in the fight against COVID.
So I got a question from Sarah in reference to wanting to know whether or not the heat will help. That's a great question, and so this is a virus. And so what is a virus? A virus is, this particular virus is a piece of what's called RNA. So it's some type of what we call nucleic acid information. It is something that is normally found within our cells, which tells our body what to do. And this little piece of RNA is enveloped. It's like in a little circle. And it's alive, somewhat, like a virus is. It's interesting. It's just like this little piece of information envelope. So it's kind of alive, it's kind of not. It's an interesting topic, right? But that virus has to survive in the air for a period of time to be able to stay there so that you can breathe it in and get it. And what we know is that the virus likes humidity. So it likes humidity because the water envelops it and it protects it from drying out. Because if it dried out, then it could be destroyed. Another thing which is helpful is cold, because cold is also a protective mechanism. And along the same lines, because it's gentler, it won't destroy things. And perhaps maybe this could be one of the reasons why, when we unfortunately saw what happened in a place like New York, happened in New York. A place that happens to be colder and a place that happens to have more humidity. And so there is some reason to believe that a place that is arid, like our home of Las Vegas, and hot, maybe could help kill the virus quicker. Now we have to be careful. The virus will still be in the air, it'll be aerosolized. All we're simply saying here that is perhaps it will be destroyed quicker. So there still could be some risks there, but yes, there's reason to believe that our particular local climate here could have some protective effects in terms of reducing transmission a little bit. Yes?
There has been a lot of information about coronavirus on surfaces. Do we know how likely you are to get COVID from touching something?
The question was, there's been a lot of information about COVID on surfaces, and how likely are you to get COVID from touching touching something? And so there are two variables there. The first variable is the surface. And so different surfaces could be more hospitable to the virus surviving. So again, in an extreme case here, luckily for us living here in Las Vegas, actually you would maybe think this is going to be lucky for the summer when it could get so hot. You could maybe have something like the virus on pavement outside where it can get extraordinarily hot. Virus isn't going to last too long there. As compared to, say, a cold table that is smooth. So there's not friction and other things, and so maybe it could last longer. So with those variables in mind, there's a surface. But then remember that you have to get that somehow into your lungs. And so you have to then touch the surface, and then you have to touch your face in some way, shape, or form, or maybe have your hands like this and breathe in, etc. So that's what we're talking about in terms of more frequent hand washing and hand hygiene, maybe antiseptics, so you kill viruses that's on your hand, and then being cognizant not to touch your face.
Can you get COVID and the flu at the same time? This question's from Lily.
So a question from Lily asking, can you get COVID and the flu at the same time? We believe that you can. And we have seen individuals that have been positive for both. So the answer is yes. One of the interesting things about COVID-19 is, to talk just a touch more specific, is that this appears to be more of an upper airway disease. I mean, I did talk about how it affects the blood vessels, and that's how we think it connects into everything else. But when it does affect the lungs, it's a little more of an upper airway. The flu tends to be more of a lower airway disease. And so that's an interesting point. But yes, you can be what we call co-infected with both. So we are out of questions right now. I really want to thank you for your time. And if any of these 5 topics of our interest to the audience, if you guys can let us know, we'd be happy to come back and talk about these things more in depth. Thank you for your time.